Awesome. All right, so good morning. Today we will be presenting to you on early childhood trauma and the impact it has on behavior and ways that you can work with young kids in educational settings. So I'm Dr. Corey Black, and I have with me.
Dr. Kasia Plessy.
And we'll be taking you on a journey today, talking about trauma and ways that we can look forward and things that we can do to support kids who may have experienced it. All right, trying to get the slide to move. There we go. All right, so what is trauma? According to the National Child Traumatic Stress Network, trauma is any experience that threatens life or may cause physical injury. And is so powerful and dangerous that it overwhelms a child's capacity to regulate emotions. And these experiences that a kid may have that are considered traumatic can happen to the child themselves or can happen to somebody that the child depends on or somebody that the child is close to. So when we think about trauma, we have to think beyond just events that happen directly to children and work to include those that they are aware of or those that they sort of experience around others that they depend on or that they have close relationships to. So here's a list of traumatic experiences. This list is not exhaustive, but it does give you an overview of things that are typically considered traumatic experiences. Some you may have thought about, others you may not have given consideration to being traumatic. So psychological, physical, or sexual abuse, neglect or abandonment, separation from a caregiver, and this can be brief separations from primary caregiver that is unannounced or unscheduled. For example, incarceration of a parent or even a deployment of a parent who may be in the military who a kid depended on for primary caregiving. Death or loss of a loved one, witnessing domestic, community, or school violence. And when it comes to domestic, community, school violence, this can also include like hearing about the violence that was directly related to somebody close to the kid. And also when we think about domestic violence, oftentimes caregivers think that if a kid wasn't present and didn't actually see it, that it didn't impact them. But research has shown that kids who experience it, even from the other room, that hear the violence and hear things related to domestic violence, can also have reactions that are akin to those related to trauma. So automobile or other serious accidents, bullying, life-threatening natural disasters, such as hurricanes or tornadoes, terrorism. So whether actually being involved in it or witnessing it on television or through other news media platforms. Living in chronically chaotic environments. So this includes kids who have unstable housing situations or parents who struggle to have financial resources and where a kid is sort of put in the place of like having to like be there and sort of deal with all of these things. And also painful medical procedures or life-threatening medical conditions. I think oftentimes parents and caregivers may think that when kids have medical procedures that it's necessary for them and that this is something that they have to do. But we also, while understanding that, think about how that kid may be experiencing it and ways that they may see it and consider, at least in some instances, the potential for a traumatic reaction to it. Right. So when we think about the impact of trauma on children, we know that we see it on many different levels. And one of the most important areas is how those early experiences impact the brain development. So chronic stressors such as chronic community violence or extreme poverty can lead to a toxic stress response. And these cumulative toxic stressors, especially in early childhood, may have negative impacts on further child development. And we see the impact beyond childhood into adolescence and sometimes into adulthood. which is why it really is important for all of those who work with kids to make sure that when we think about their experiences, that we are addressing their needs early on so that we give them the best trajectory for success later in life. So children can be affected by stressful and traumatic events, and while they experience them, they may not be able to understand them and may not have the words to actually communicate how they feel. And oftentimes we see kids' reactions to these experiences through their behavior. So all behavior is trying to tell us something. And when kids have reactions to traumatic experiences, we have to pay close attention to the way that they're behaving and the things that they're trying to communicate to us. And more so than ever in those moments, they need more caregiver support and more guidance from the people in their settings. So that can include primary caregivers, but also includes teachers, other health professionals, and all of those that they depend on. So again, while we want to always support kids in early childhood settings, they may need even more support from us when they experience things that may have been potentially traumatic. And this is especially true when they aren't able to verbalize or able to find the words to actually describe those experiences. So some of the common reactions that we see in early childhood for kids that have experienced trauma are newly developed separation anxiety and clinginess. So for example, if your child was doing okay with being apart from you, like to maybe be with a grandparent or to go to childcare, but now they're having significant difficulty that wasn't there before, this may be in reaction to a potentially traumatic event. Excessive crying and screaming, again, that is out of the norm for that child. Difficulty with transition, so moving from one activity to another or with moving from one setting to another. Sleeping and eating difficulties, so having a tough time going to bed at night or not being able to sleep through the night, and also maybe not eating as much, and on the other hand, starting to like eat way more than they have before and start stuffing behaviors. And when you see significant changes in their weight related to the diet. Regression in behaviors. This is a really big one and one that is often seen in early child care centers. You may have a kid who was previously potty trained and is now having daytime accidents. Or you may know a kid who was developmentally appropriately interacting with peers, but may now behave more like a child significantly younger than them. Also, being hard to soothe and playing less with their peers. And again, this is not an exhaustive list, but these are the things that we want to sort of keep in mind when we see differences in a kid's behavior and see that they have maybe shifted from what we have experienced as their norm. So while those changes in behavior may happen, we may see significant increase in difficult behaviors, such as peer problems or being more disruptive in childcare settings. But on the other hand, a kid may internalize these reactions and you may not be able to see those symptoms. So they may become more reserved or they may not interact with you or interact with their peers as much as they had before. And oftentimes when kids have experienced traumatic events, they receive incorrect diagnoses such as ADHD or oppositional defiant disorder and conduct disorder. Also may appear to have developmental delay or learning disability when in fact these behaviors are a reaction to the trauma or the multiple traumatic experiences that they may have endured. And this kind of carries on from what I was saying earlier, is that when kids experience trauma in early childhood, it's best for us to try to address it as soon as we can, because the impacts are not just are not confined to only childhood, and it can extend well beyond childhood. Oftentimes, childhood trauma survivors experience learning problems and more behavior difficulties in school settings, increased use of mental health services and other health services, more involvement in juvenile justice systems and the child welfare system. And we also see changes in physical health, such as increased risk for diabetes or heart disease. And trauma is a risk factor for almost all behavioral health and substance use disorders. While these things do not happen to everybody who experiences trauma in early childhood, we want to make sure, again, that we are doing what we can to support these children and address their needs, so that we can, again, try to give them the best outcome possible and be able to help them have successful development and successful adulthood. According to SAMHSA, the prevalence of trauma exposure for kids in early childhood, specifically ages 2 to 5 years old, is about 52% had experienced severe stress in their lifetime. And more than 67% of those children report experiencing at least one traumatic event by age 16. So this is a very significant percentage of the population that has experienced severe stressors and traumatic events. And among the children being treated or assessed for trauma, 78% of those had more than one trauma reported, and the initial trauma occurred at age 5. So a lot of these people who were being supported had reported traumas that had happened early on in life. So again, this is not something that is uncommon, unfortunately, but this is something that we want to make sure that we are addressing and thinking about in the settings where we work, to make sure that we're keeping an eye out and also having regular communication with the professionals in our settings that are able to take the next steps and fully support and treat these children and families who experience trauma. Another way to think about traumatic experiences is through ACEs, so adverse childhood experiences. And these include, these are similar to what we talked about earlier with the traumatic experiences. So physical abuse, substance abuse in the home, parental separation and or divorce, sexual abuse, mental illness in the home, so mental illness of a caregiver or a close relative who lives in the home, emotional neglect, so a parent who may not be physically abusive or may not physically aggress on a child, but who is not necessarily emotionally present and doesn't offer those things that we know help kids grow and develop positive relationships. Domestic violence in the home, psychological abuse, physical neglect, and criminal behavior in the home. And when we think about ACEs and how they're related to outcomes in adulthood, adults who reported having a higher number of ACEs were at increased risk for a multitude of physical health outcomes, including chronic diseases as an adult, depression, suicide, having physically aggressive tendencies, but also becoming a victim of violence, along with alcoholism and increased risk for serious financial difficulties. And again, all of this is to, again, illustrate the significant impact that these experiences that are in early childhood have on continued development, and why your role is so important in helping support these children and families and making sure that you're working with others to get them the services that they will benefit from. So here's just some prevalence data on ACEs. About 45% of children have one or more ACEs, and sadly, about 10% have 3 or more. And again, unfortunately, only about 20% of those children with mental, emotional, or behavioral disorders actually receive care from specialized mental health service providers. And that's where people who work in early childcare centers come in, because they spend the most time with kids. They're able to know the development and know if there's a change in behavior. And they're often the kid's first line to somebody who is supportive and caring and can sort of like ring the alarm or blow the whistle on things that may be happening so that that kid can have more access to mental health service providers who can get them the supports that they need. Because in the absence of that support, those kids develop survival techniques. And while those survival techniques may be advantageous in certain situations, they're often disruptive and counterintuitive and not productive in childcare or in other educational settings.
So, what can you do to support children who have experienced trauma? Um, the first thing that we're going to say is kind of the first thing that we always say when we're talking about supporting children, and that is taking on a top down approach. So, we're going to encourage you to think of yourself first and think about how you can regulate yourself before you interact with a child. Remember, in our previous talk, we talked about some breathing exercises that you can incorporate, really quick ones to kind of, turn off that emotional survival brain and kind of, settle down our big emotions because trauma may be affecting that child in the moment, but it can also trigger us. So, you might tell yourself, I need to calm down before I calm someone else down. Or in order to understand this child, I need to change how I think in this moment. So talk to yourself. It's a very important skill. Um, and we want to, create awareness by understanding the trauma response. Spending time to try to understand where this response is coming from for this child. What is coming up for this child? What context information do you have to help put their behavior into perspective? We want to practice self awareness by knowing our own triggers and know how to regulate ourselves, like I mentioned before. So this means shifting our shifting our perspective, trying to see from the eyes of the student. And this means creating an awareness about what a trauma response is. Asking yourself, are you responding to something outside of this room? Are you responding to something that this child is doing and it's bringing up something for you? So, in order to be able to kind of create a perspective for this child and a perspective of your own reactions, you have to know your own triggers and how to regulate yourself. And finally, build relationships with students that are deeper than learning colors and shapes. Pour into them with the perspective that you don't know when their next hug is going to come, right? You don't know where the next praise they're going to get. You don't know when that will happen, the next time that they'll hear a kind word, or really be uplifted. So having those strong relationships really helps a child who has experienced trauma, who is dealing with big emotions. Having that foundational relationship is just so important. And so, what does a trauma informed classroom look like? A trauma informed classroom is built on an understanding of the prevalence and impact trauma and stress have on a child's development and school functioning. So, first, as teachers, you teach. We mentioned in our last presentation the importance of teaching what we expect from our kids outside of academic skills. So that is the same, just as we teach colors, shapes, numbers, we also want to teach them about their brains, about what stress, big feelings, what that does to your system, what that does to your body. And that can be very, developmentally appropriate conversation. So, of course, a child may not be able to understand the complexities of ACEs and stress, but they know when their body is feeling a little tense, or maybe when their face is feeling a little hot because they're feeling angry, or when their body just feels kind of like a noodle, wacky, wiggly, and they're just having these big body feelings too. So you can talk to them about that. And then talking to them, teaching them, this is a reaction to how you might be feeling. And here are some ways that you can deal with that big feeling. So teaching them basic coping skills. Kids are not born with the ability to cope. We have to teach them. We have to teach them these coping skills as adults. And so, that is the first step in having a trauma-informed classroom. We also want to create a space that acknowledges a child's feelings and a space for them to calm down. So, as we've probably said multiple times throughout many of our presentations, it's really great to have a space in your classroom that is a safe space, maybe a cozy corner. And this is something that a consultant can help you with. But having a place, a safe space for a child in any space where they can go and kind of have the time to calm down, have the space free from other friends, where they can kind of acknowledge their feeling and calm down. That is really helpful in teaching them, how these are the reactions that your body's having. You can go in this space and use these coping skills that we've talked about. We also want to provide choices. So the feelings associated with trauma go hand in hand with feeling out of control. In traumatic times like COVID and hurricanes, don't we all look for areas in our life that we can control? I think that's been kind of the hardest part of this pandemic, and other, natural disasters or traumatic times. We don't know what's going to come next, and we don't know what to do. So we're looking for ways that we can get control. And kids are the same way. Give kids a sense of control by providing choices about what to do in a classroom and what to do to calm down. And we also want to be aware and mindful. So be aware of potential triggers when practicing mindfulness with your students. So use mindfulness skills like deep breathing, yoga stretches, or other conscious discipline strategies that we mentioned in the last talk to instill calm into chaos. And again, just being aware of the potential things that may trigger a student or a classroom environment, and knowing that those triggers mean that after this moment, let's use some of our skills. So we have some good news. And news that is really relevant to the work that you do, which is early intervention. We know that early intervention can prevent negative consequences. From the National Child Traumatic Stress Network, a study found that children who experienced extreme neglect and who are placed in foster care before age 2 had higher IQs and were more likely to have typical attachment relationships than those who were placed in foster care after age 2. So really what this is telling us is that early relationships matter. You are in an important space for early intervention. And we know that relationships matter, relationships matter, relationships matter. So, having this time in which, at a young age, if we get in there and provide caregiving, provide nurturing and responsive relationships for these kiddos at a young age, even if they have experienced some difficulties, some challenges, even in their, short lifespan, we are able to really foster resilience. And that's what we're going to talk about next. You may have heard that kids are resilient. I feel like I hear it often, and it's very true. Some children demonstrate a strong capacity for resiliency. So, what do y'all think of when you think of resilience? I think living through natural disasters here in Louisiana, living through a pandemic for multiple years has really brought the idea of resilience to the forefront. Resilience is the process of adapting or bouncing back in the face of adversity, in the face of trauma, tragedy, threats, or significant sources of stress. So it's the ability to overcome serious hardship. And as you know, I mentioned previously, children don't become resilient alone. They don't learn to cope alone. They don't become resilient alone. Um, we as adults want to promote a child's resiliency so that difficulties do not determine the outcome of their life, right? We're in this unique, this really great space of early intervention, of building resiliency so that down the line they don't experience as many negative outcomes that we know is associated with trauma. So, you know, having at least one stable and committed relationship with a supportive parent, caregiver, or other adult really changes the trajectory of these children's lives. It helps them when you're able to demonstrate resiliency, you really teach them to become resilient.
All right, so now I want to sort of shift gears just a little bit to have you think about your way of interacting with kids and viewing their behavior. I know oftentimes we revert just to what we know, either the way we were raised or our experiences in childcare settings, or our experiences with children outside of childcare settings, and think about like kids' behavior as possibly doing it on purpose or because they want something or because they saw somebody else do it. But I want us to sort of add to that and think through using our trauma lens to better understand the kids that we work with and to get a better idea of ways or better yet experiences or things that they may have encountered have impacted the behavior that we see. Again, all behavior is communicating something, but it's up to us to determine what is the best explanation for what a kid is trying to tell us and what next steps we should take to best support them. Right. So now I just want you to take a little bit of time and think using your trauma lenses to think through these different behaviors that are often seen in childcare settings. So when we look at these descriptions, we may have like a knee-jerk reaction or a sort of immediate thought as to what a kid wants when we see these behaviors. But I want you to think through your trauma lens to try to determine what you think a kid is trying to communicate or what it may mean for that child. Okay, so I'll just give you a minute just to think about that for a second. Okay. So if we put on our trauma lenses and sort of rethink the way that we see these behaviors, we may surprise ourselves in thinking that we have a better way of understanding one, what our kids have experienced, but also ways that we can sort of view the behaviors. And viewing behaviors through a trauma lens also, one, gives you perspective of the kids, but also helps you develop a certain level of empathy, which may also impact your reaction or just your action towards the behavior, and being able to support that kid and help them come back to a place where they can be successful and be have a positive experience in a childcare setting. So, for example, if we think about manipulative behaviors, one way to think about this is, oh, the kid just wants a toy; they just want to have their way all the time. But if we think through with our trauma lens, we may better understand that, oh, well, maybe this is a coping technique. Maybe this is something that they've had to develop in response to traumatic experience. And while it may work for them outside of this setting, we have to try to find a different way to help them be successful in the classroom and help them sort of shift that to a way where they can still obtain the same safety and the same goal but with a more appropriate and more conducive behavior. Uh, or if we think about clingy, often hear folks describe clingy behavior, oh, as a baby is spoiled, or they just always want to be around you, just want somebody to hold them. But let's also think through what experience they may have had. So, like, what has happened at home? Like, what may have happened to primary caregivers? There's a shift in how he or she is responding to the baby. Is there a difference in who is caring for them? Maybe they have a strong relationship with you, and for many reasons, you are the person who, in their daily life, is the most consistent. So, for example, a kid who may have recently entered foster care, or a caregiver who may be sick and the child is currently under somebody else's care, you serve the purpose of being the most consistent and the closest relationship that that kid may have. So, I think if we use our trauma lenses to better understand a kid's behavior, it helps us have a more empathic response. And thinking through trauma lenses doesn't mean completely understanding and having details about a kid's potential traumatic experience. It means understanding that with the prevalence rate of traumatic experiences, that oftentimes kids may have experienced traumas that we will not ever know about. And if we think through their behaviors from that perspective, we can respond in a way that's more supportive and that is not re-traumatizing, or that doesn't further exacerbate the difficulties that they may be having. Right. So now we're going to talk a little bit about challenging behaviors and ways to better think about them in the child care setting. So when we think about challenging behaviors that are exhibited by the children and families that we work with, we want to think about who is demonstrating that concerning behavior. So who is this child? So one, thinking about, again, their experiences outside of the classroom, but also, like, is this out of character for them? Is this something that is typically happening? Or is this a newly developed behavior? So just better understanding who is actually demonstrating that behavior. What do you know about the child and his or her family? This brings in that relationship aspect where we want to build relationships not only with the kids, but with their caregivers as well. So we can have better communication about changes in the kid's life or changes in their routine that may help us better understand what they're going through, but also help us better understand how to support them, and also ways to help caregivers support them. I think we often think that primary caregivers sort of like have, I don't know, a magic wand and have like ways that they are supposed to deal with kids, and that they are the ones who know everything and should fix it all. But spending time with the kids in your settings, you know a lot about them too. So if you develop that relationship with families, you may be able to help them have a better perspective of the kid, of their children, and help them develop more useful ways to support the kids outside of the educational settings. Um, so thinking about how often do you communicate with the family about the good things that are happening? This is a huge piece, and this also helps to really build that relationship. Caregivers of kids who have challenging behaviors are often put in a place of, every time a call or some sort of communication comes through, it's about the challenges that the kid is having. And this is, it can be overwhelming, and it can sort of push that relationship that the caregiver has with a child care setting to a really negative place. So we want to think about being like conscious and actively communicating the positive things that are happening with the kids that we work with. Because seldom are kids having difficulties the entire time that they are in our settings. And we want to make sure that while we want to communicate the challenging behaviors, we also want to make sure that caregivers know about the good things that the kids are doing. And also it helps shift our perspective in working with them, because we can see the good things, even though we can also identify things that we want to help them work on. And how do you communicate with the family about challenging or concerning behaviors? So one way to think about this is when you have to communicate challenging behavior is to sort of loop in those good things that are happening in the settings, to sort of give caregivers a holistic view, and also present it from a way where you have thought through ways to support them, or things that have worked for you or that haven't worked for you in the classroom, and just sort of maybe even in those brief moments, problem solving with families to try to think about maybe what is going on or what things are happening that may have impacted the kids' behavior. And this cycle is not something that happens one time. Like, this can continue to go on for the same kid, even at different moments. So you just want to think through all of these questions when thinking about like what is happening, and also who are you actually working with and trying to support. Okay. So when we think about the what, so what are the concerning behaviors? So actually defining what behavior you see. So when we think about a kid who may have disruptive behavior is a really broad term and it's really vague. So we want to think about specifically defining what is going on. So a kid is having aggressive behaviors with a peer, or a kid has an emotional response during transitions. So thinking specifically about what is happening so we can better determine how to support that kid and family. So what impact do child, family, and center culture have on those behaviors? Again, this is where the relationship with caregivers plays a huge role, because there may be certain things that are allowed at home that maybe aren't allowed at school, and vice versa. There may be certain things that we do in centers that kids are allowed to do, so such as playing with certain toys or interacting with peers in a certain way that families may not allow a child to do at home. So having that understanding about the difference in family cultures versus the center culture, and also having those conversations may better help you all understand what that kid may need in that moment. And also, what is the magnitude of the concern? So we talking about a behavior that is related to one kid, or is this a behavior challenge that sort of encompasses the entire classroom? So multiple kids are having the same difficulty, or is it something that's pervasive and it's across the setting of the center? So these are challenges that need to be addressed in multiple settings. Better understanding the magnitude of the actual behavior allows you to know what sort of level you need to make change. So if we're thinking about one child, this is focusing on that kid and their caregivers, versus center difficulties, which may require some sort of trainings or some sort of culture change and some top-down um, response to difficult behaviors. Right. And the when and the where. So understanding when a behavior is occurring is hugely important. So is this something that happens only when the kid is dropped off by a certain caregiver, or is it before a nap every day, or is it only on Fridays before a kid is going to be away for a couple of days until they return on Monday? So better understanding the when allows us to better define what is happening and the things that we can control to support it. And where does the behavior occur? So is this something that occurs solely in the classroom during maybe circle time, or is it something that you also see outside when peers are interacting, or at lunch as well? So again, better understanding the when and where allows us to better determine ways to intervene and think about the things in the setting that we can actually change to help support a kid.
So, we want to talk about what the child is trying to tell us. Trying to figure out the meaning behind the behavior is the most important thing that we as adults can do to help support children. We can't solve a problem if we don't know what the child is trying to communicate. And that's true for adults too, right? We have to understand what the meaning is before we try to solve the problem. And children communicate in many different ways. Um, there are different forms of communication. Ones that are more obvious and more helpful for us when we're trying to determine meaning, right? So like words, sentences, even pointing up to a picture, that could be a pretty direct way of communicating. But there are other ways that children communicate, and we have to look for those cues. And those cues, those forms of communication can really help us figure out what this child is really looking for in this moment. So, an eye gaze, pulling on the adult, pulling on your pant leg, pulling on your hand, crying, of course, is a form of communication, especially for a child who does not have the language, a younger child who doesn't have the language to kind of communicate in a more direct way. Biting, so as Dr. Black mentioned, sometimes we can see a child's behavior and we think that it's done as a form of manipulation, or they're trying to intentionally cause harm. But it may be that biting is a form of communicating, I need something to chew on right now, or I'm having big feelings and I need to get it out in some way, in a physical sense. I have a physical sensory need, maybe. And then, of course, tantrums. Tantrums are big ways for little people to communicate. And we know that, the best way to address challenging behaviors and support a child through challenging behavior is to figure out what it's doing for them. Do these They're doing these behaviors for a reason, right? And so it's our job to figure out what it is. Maybe the function behind this behavior, they're doing it because they're trying to request an object or an activity or a person. Maybe they're trying to escape the demands that are being placed on them, maybe because they know that they can't do the demands, or they don't want to do those demands right now. Trying to escape an activity, escape a person, or they're trying to request help or request a social interaction. I always find that one really interesting, that, sometimes children have to be taught how to play and how to interact with other kids. And so they might know that hitting a friend, they're not trying to hurt them, but they know that a friend is going to scream or cry or create some type of reaction, and therefore an interaction. So maybe it's, they're trying to have a social interaction with someone else. They're trying to comment on something, request information. Again, that request sensory stimulation or escape sensory stimulation. So either they're really looking for some type of stimulation, looking for that physical touch, that hug, that sensation of biting, or the sensory information is too much and they're trying to escape it, and maybe that's what behavior is trying to say. So how can we figure out the message? Well, we figure it out by looking closely at the environment for cues. And what we as mental health consultants do is we use a very specific method to determine the meaning or function behind a behavior. And so then we work to, figure out the meaning behind that behavior, and then work with the adults that are experts of the children in their classroom or in their home to figure out how to meet the needs of the child in a productive way. Because, as I mentioned before, often behaviors persist because they work for the child. So having a tantrum in this moment works. It gets them what they need in that moment, what they're trying to communicate, and so they continue to do it. So how do we get them their needs in a more productive way? That's the question we're asking when we're going through this next step of the MHC mental health consultant method. So we're asking, what happens just before this behavior? What is the exact behavior you would like to see changed? And what happens after the behavior? So these are the three questions that we're asking. While going through the details of how to do this method is beyond the scope of our talk today, just using these three questions can help you start to think about the behaviors, what might be contributing to them, and what is keeping them going. And we're just going to focus on two of them. mental health consultants can help create a behavior support plan that really asks these questions and integrates a lot of the skills that we've talked about over these past two talks. Um, you know, we are going to focus on the prevention strategies today because that is the most important thing that you can do in your classroom every day. Um, and prevention, so we've talked about the behavior hypothesis, finding the purpose of the behavior, your best guess about what the behavior why the behavior occurs. And prevention is key. Often we're thinking about how do we respond, what do we do when a child does this, and what do we do when a child does that. Well, really, there's definitely responses that we can take, but often prevention is the most important thing that you can do. We want to find ways to make events and interactions that trigger challenging behavior easier to manage for that child. And you'll notice that by focusing on the prevention, that is really going to reduce the rate of challenging behaviors in your classroom, rather than just only responding. So let's talk through some prevention strategies. Here are some questions you can consider about your classroom when you're thinking about preventing challenging behavior. And remember, as I mentioned before, challenging behavior often sticks around because it works. So we want to make an environment that makes it unnecessary to act out. So some questions to ask. How can the environment be changed to reduce the likelihood that challenging behavior will occur? So do I have to move some furniture in the classroom around so that there's not basically like a racetrack in the classroom where kids can kind of run all over? Do we need to make some more obstacles? Do I need to have more signage in the classroom that really directs them of where to go? Visual cues that directs them, okay, well, challenging behavior is happening when we're lining up to go outside. So maybe I need some type of footprints, which, I'm kind of giving away what I'm going to talk about next, but some footprints on the ground that kind of shows them where to stand. What can I do to make challenging behavior irrelevant? What procedures can I select that fit in the natural routines and structure of the classroom or family? So we don't want to, make this new, elaborate, difficult to understand and implement strategy. We want to figure out what works for you in your classroom. And how can we build on what works? So many of you are doing such amazing, great things in your classroom, and maybe we want to stick with that, but maybe add another level that maybe misses something, some need that's trying to be communicated. So, we don't want to reinvent the wheel. We want to build on what works. And what can be done to help the child not respond to the trigger or change the trigger so it does not cause challenging behavior. Now, the strategies that we're going to talk about are helpful for all young kids. I like to say that. But I really want to point to those who, in these talks have talked about needing strategies for children with special needs. These are really helpful for children with special needs. And all young children, because they're helpful because they use visual guidance, as you'll see in the next slides. So this is a visual. Back to visuals. Visuals are so important. One preventative measure is having something that gives children an expectation and guidance on how to line up. So you could say, go line up, and maybe some kids will, and maybe some kids won't. Maybe they're all on top of each other, crowded on each other. That leads to pushing. And then, there's some challenging behavior that could be there. But if you have a visual on the floor, it's eye grabbing. Kids have something that is specifically theirs, their little footprint, and gives them a rule that they can follow. This prevents challenging behavior. And so we're not spending so much time focusing on and responding to challenging behavior that happens in the line. You've prevented that behavior from even occurring. Another visual that we love to see, we love classrooms that have visual rules. Going through the rules in the morning during circle time to set up the expectations for the day. It can be fun. You can use one child who has difficulty in circle time. Usually that time is really hard for them. Use them as an example of, can you get this child to show, hey, can you show your friends your listening ears, your walking feet, your looking eyes? Use them in a model. Use them as an opportunity to get attention, meet that need of maybe wanting attention from friends or wanting attention from the teacher, well, in a productive way. So visual rules in the classroom are really, really helpful, and can be used as a teaching method outside of just teaching what's the expectation of the rule, but also teaching how to interact with friends and how to get, that attention need met. Another um, good preventative strategy is the first then schedule. So this is a form of a daily schedule that could be helpful with your students, especially for the ones that have difficulty with transitions. So this gives kids an explanation about what is coming next and can prevent problem behavior. So, if there's a kid who is really having difficulty, transitioning from one activity to the next, you can guide a kid to the schedule. You can say, hey, okay, first we're going to read a story and then we're going to go outside, rather than just saying, no, we're not going outside right now. We're going outside later. It's you can walk them through, the time series and give them a good expectation about what is going to come next, and kind of gets them involved. You're not just saying, no, we're not doing that. You're saying, we're going to do this, and then at this time, we're going to do the activity that you want. Similarly, using visual schedules is also a preventative step in classrooms because it increases an understanding for kids and helps create a routine. So this is, a that was another form of visual schedule, and a choice board for songs. So this goes under the theme of providing choice to kids is always a really great way to prevent power struggles, to prevent challenging behavior, and to address, remember we talked about a trauma-informed classroom provides choices for kids, choices of what to do next, gives them control in their environment, and especially when they may be feeling out of control because of trauma. So providing choices will always be a preventative measure. It keeps kids' interest because the activity was their choice. I will never forget this. I saw this in one center, and a teacher had something similar to this, like the names of the songs, but she had them on popsicle sticks, and it was all in a jar. And so the popsicle sticks were out, and the kid would pick during a time of transition. Usually, it was right before lunch came, so they had sat down at their normal time to wait for lunch, but lunch was running a little bit late, which it happens. And so she would go around and bring the jar around, and a kid would pull a song, and the whole table would sing that song, and then they'd put it back, and then she'd go to the next kid at the table and they'd pull a song, and then they'd all sing that song. Gives them a choice. It gets them actively involved, and prevents some challenging behavior that can happen while we're waiting for lunch. So here are some preventions to minimize the effect of the setting event. So minimize the effect of a transition or starting an activity that may trigger some challenging behavior. So you might want to provide the child with a calming or desirable activity. Maybe giving them their favorite stuffed animal or book for them to kind of keep with them. You want to decrease the demands on the child. So if it's a transition time and the child's already having a difficult time, let's not add more by adding more demands on them, asking them to do a lot of more things. You want to increase attention and comfort, but decrease demands. And you can offer them a chance to rest or cuddle if it's a time that is really difficult for them. A great opportunity is, giving them the chance to go into the cozy corner or to the library, the quiet library for a moment, and kind of, practice their coping skills and then come back. And then, we want to be preventative, provide additional supports for routines and activities like transition warnings, getting down to their eye level and saying, we have 5 more minutes before we transition, before we go into our next activity, or, a flicker of the light or some type of visual warning. And all of that can just be helpful in supporting the child through what may be a difficult time for them. Remember that this is trial and error. So, none of us have a magic wand to, solve all of the challenges that we have in our classroom. So there are things that we may try and it may work, it may not. So you all know as professionals in your field that we can't take a one size fits all approach, considering that there is a wide range of temperaments, of personalities, of histories, of learning styles in your classroom. So we know that there's not one right answer. It may be necessary to try again, especially if you've not gotten a full understanding of the behavior. What we know is that it's important to be consistent. So if you have decided to use a specific way of responding to a child's behavior, use it consistently before saying that it doesn't work. So try for 2 weeks consistently and then reevaluate what worked, what didn't. It may feel like extra work to be consistent and try to implement this consistently every single time, but we know that it prevents challenging behavior in the long run. So, it's actually less work in the long run, although it definitely takes a while to kind of figure out the behavior meaning, figure out what prevention strategies work. And think about what is success. So think about what success with a particular child, a specific child, looks like to you, and then discuss it with the other adults in that child's life. If a child is having very severe temper outbursts and he's throwing chairs or she's knocking over tables, success may be that when a kid is angry, they start stomping their feet on the ground. Maybe that may be seen as disruptive, but that is a big success for this child who was previously doing really dangerous behaviors. So what does success look like to the teacher, to the parent, to the director? Be on the same page and have these conversations. And how are our ideas different? They're going to be different because often child's behaviors are different in the classroom versus school. So look for small victories. And it's hard when you're in the middle of it to see small changes. I know that's the case for me when I tried to do anything, any change, trying to work out, trying to do better. Sometimes it's hard to see the small goals that I have accomplished. But the small changes really do matter. So look out for them. Kind of wanted to end with a moment of reflection. So think about the takeaways and the goals that you want to have based on the information that we've presented in this presentation. I'd ask you to look at the prompts on the next slide. We're going to write down 1 to 3 things that you want to remember. Write down one goal you might have for your class and set a start date for implementing this goal. So it's that accountability of, I'm going to try just one small thing. I'm going to try to be consistent in it, 2 weeks, remember, and I'm going to start it at this date. And then 2 weeks later, I'm going to reflect some more and see what worked, what didn't. So we encourage you to do this as we end our time together. Just a reminder of where you can go if you are interested in getting consultation to really follow up on some of the things that we've talked about. A lot of times we talk about things like this, about things that you can implement in the classroom, things to look out for, and sometimes it could be hard to implement in your classroom or in your situation, and that's where a mental health consultation can really help. So if you're a Type 3 center or an FCC site, you can reach out to us through our website, so feel free to scan, and we provide support to our village of caregivers here in Louisiana. And here are some resources that you might want to look into and where we pulled our information from. And we're going to end it on this slide. This is just our social media. Feel free to check us out. We have a lot of tips and tricks that we put on these different social media sites. So, you know, we always love to share information. We love to make connections in the community. So check us out here. We'd like to say thank you so much for your attention, for your participation, and we wish you all well. Thank you.